moving towards the seventh scientific session. The world reveals itself to those who travel on foot. But what happens if you are a diabetic? Can a diabetic patient trek or climb up the mountain? To discuss on this topic, high altitude trek and diabetes, we have our next renowned speaker with us, Dr. Professor Anirban Majumder, Professor of KPC Medical College and Hospital, a renowned endocrinologist. And to chair this particular session, I'd like to invite Dr. Nirmala Chakraborty, one of the renowned senior cardio-diabetic consultant, Dr. Shoibal Chakraborty, renowned medical consultant and endocrinologist, Dr. Shottam Chakraborty, consultant endocrinologist, Fortis Group of Hospital, and Dr. Shupriya Datta ma'am, senior consultant and diabetologist, who has profound interest in research work and got several awards through her work. I request both the chairperson ma'am. Ma'am, please take your seat and introduce our speaker, please.
So without wasting any time, we are going to have a wonderful session. I can assure you, Anirban has always been very, erudite speaker, and I think you are going to have a topic which will be kind of a storytelling. I think I have heard some of it. He himself is a very well-known, renowned trekker, and I think whatever he will say is his own experience, real-world data, as you can say, and without wasting any time, Anirban, the floor is yours.
Yeah, thank you. So thank you, chairpersons, and it's my pleasure and honor to be here in front of you. And I'm going to talk about this high altitude trekking, and I will consider some of the issues related to diabetes as well. But the first thing is that the patient eshe prothomei jigesh kore Dr. Babu treke jete parbo? The first question. Because Himalaya is very close to us and people want to go there. Second, jodi jai kichu hobe na to? And third, jodi kichu hoy tahole ki korbo? So I think all of us, all of you must have faced this question, and in the next 20 minutes or so I would like to answer these questions in my talk. So how the acute adaptation takes place in the high altitude, and you need to understand that when we ascend, so quite naturally the partial pressure of oxygen progressively goes down in the air, and as the air pressure goes down, so quite naturally there will be hypoxia, and if there is hypoxia there will be sympathetic activity. So if there is sympathetic activity, so the ventilation will increase, and this is the way there is a some kind of adaptation occurs. Now we need to remember, number one, that when there is an activation of sympathetic nervous system, there is a possibility of hypertension. So blood pressure slightly goes up, though at the same time we have to remember that the hypoxia actually causes vasodilation. So there may be some contradictory effect of hypoxia as well as sympathetic overactivity. The second important point that we need to remember, above the height of 4,000 meter, this acute adaptation actually fails. So more and more you are going up and up, the adaptation process gradually diminishes, and you have to remember that we need a good preparation before we start the journey. Now the second important issue that I am very interested to look into, what is the endocrine adaptation, because I am an endocrinologist, so I have looked into it. The very important fact that we have to remember that there is a progressive rise in the insulin resistance. And if there is an insulin resistance, so quite naturally there is a possibility of hyperglycemia. But at the same time we have to remember that if you are going for trekking, you are walking and there is a possibility of hypo, and very importantly above the age of 4,000 or 5,000 meter there is an anorexia, and therefore the food intake is less. So these are two counter situation actually happens with the advancement of the trekking. But the most important issue that I need to inform you, all of you being as a physician, that high altitude actually facilitates sarcopenia. Now whenever somebody goes for the trekking, the usual, all the trekker guide is that you take good amount of glucose. But my advice is take good amount of protein, because when there is an hypoxia, there will be sarcopenia, and only way by which you to some extent can prevent sarcopenia is to take protein, and you have to take excess protein during the whole trek. Now this is the issue that we need to understand before we advise somebody, because as I've said, you will face this question. So quite naturally, whenever you want to advise someone whether he or she is permitted to go for trekking or not, then you have to evaluate the cardiovascular and respiratory function. Remember, anyone can do the trek up to the height of 2000 meter, no doubt. Between 2000 to 3000 meter is basically allowed if you have a stable condition, whether it is a cardiopulmonary or it is a respiratory. So if you have a very stable cardiac situation, if you have a very stable pulmonary situation, then you can allow them up to 3000 meter. Beyond 3000 meter, if somebody has cardiovascular disease or pulmonary disease, it should be more or less no, no, no. Once the more than 3000 meter is basically high altitude. And if someone has got a very much desire to go for high altitude trekking, he should go special evaluation for cardiovascular status and pulmonary status if he or she plans for going beyond 3000 meter. So I also have the interest to know about if someone who has diabetes can actually go for trekking or not. The issue is, again, you have to look into the cardiac issue, because many diabetic patients have significant cardiovascular issue that we need to factor while we advise a diabetic patient whether we'll go for trekking or not. At the same time, we have to remember that there is a possibility of hypoglycemia and hyperglycemia. So quite naturally, the patient should take the glucometer and the glucose, and he has to frequently check it and can take care of himself or herself during the whole period of trek. Though self-care, if he is actually quite adequately understood the self-care for the diabetes, then I think there is no point of objecting someone who have diabetes to go for trekking, irrespective of whether he or she has type 1 or type 2 diabetes. So 3 things you have to remember. 1, he should not have significant cardiovascular issue. 2, he is able to self-care about his diabetes control. And number 3, he has understanding about the altitude related sickness and its treatment. So we were basically 9-member team when we have started, and among 9 there are few were the physicians. So we had 3 guide and 4 porters, and let us have a look into how we prepare for the trek. Now before you prepare for the trek, you have to understand that how much height you are going to attain. So this is actually Everest Base Camp. So we started from the Lukla, and Lukla is situated under 2000 something meter, and we are supposed to go to Everest Base Camp, which is roughly around 5300 or 400 meters. So that's roughly you are going to gain roughly around 3000 meter of the height during your whole trek, which we have actually planned to go for 10 days. So 10-day walk. So you will reach the place, and every day you have to walk roughly around 6 to 8 hours. So that you need to be understand, and the total trek in 85 kilometers. So 85 kilometer in 10 days, so 8 kilometer every day, and usually always speed is actually 1 kilometer per hour. So that's why this is more or less, I think there is a plus minus something there. Now when you want to prepare, then there are a lot of guidelines in the internet, and one of the important guideline comes from India Hikes. You can look into it, India Hikes, how they ask you to prepare yourself. This is quite, exhaustive, and I found it is very difficult to follow. So frankly speaking, I have not prepared this much. So, but it is up to you. You can prepare yourself as it is recommended by the India Hikes. But if you ask me, then my preparation was much less as recommended by them. The next point is that how you assess that whether you will remain fit during the trek or not. The most important issue that we need to understand that if you have a previous experience, and if you have already gone for the trekking, and how you had issues during the last trek will significantly impact on the future trek as well. So I had the experience of doing Annapurna Base Camp last year. So I know that up to 4000 meter I will not have any problem. So because I didn't have any sickness up to the 4000 meter. So that is why I was quite confident up to 4000 meter. Now before I go for the trek, I thought that let me look into the diabetic status. I am not a diabetic, but anyway I applied the AGP chart. And during the process of training, when we are actually preparing ourselves, so I had done an AGP monitoring before we start. So this is a 10-day monitoring, and you can see that the TIR is actually 100% within the normal range. So I am not diabetic, so TIR was perfectly okay. And this is the exercise we have done, and this is the calorie I have spent. And also during the days when the calorie spent was much less, I was doing some other exercise rather than walking. So this is basically data I am showing you from my iPhone. So this is the iPhone data. Now the question is that what is the challenges? Now you have to be prepared that what will be the challenges while you are doing for the high altitude trekking, that apart from the minor issues like say for example nose bleeding or some diarrhea or other issues, the most important challenge is the acute mountain sickness, high altitude cerebral edema and high altitude pulmonary edema. We have to remember that the acute mountain sickness is quite common, and acute mountain sickness is very reversible, and acute mountain sickness is not very not very problematic, but it is very common. But the issue is, if you do not take care of the acute mountain sickness, you will land up into high altitude cerebral edema, and if you don't care of high altitude cerebral edema, you will land up into pulmonary edema where the mortality rate is very high, so 25 to 50% mortality. So the approach is that take good care of the acute mountain sickness, otherwise you will land up into this, and then it will progress into the high altitude pulmonary edema. So we landed in the Lukla airport, that is roughly around 3000 meter, and in Lukla airport is one of the most dangerous airport in this world. If you know or don't know, so this is the most dangerous airport. And from the Lukla we went from Phagding to Monjo, and from Monjo to Namche Bazar, and in Namche Bazar actually we crossed the 3000 meter. So once you have crossed the 3000 meter, you means you are in the zone of high altitude trekking. Now when we look into the altitude, you must understand what is the classification. Now usually 2000 meter is low altitude, up to 3000 meter is a moderate altitude, 3000 meter to 5500 meter is high altitude, and more than 5500 meter is basically extremely high altitude. So Everest base camp is basically around 5400 meter. So therefore we consider it as a high altitude trekking. So you need to understand that higher the height, the higher is the possibility of sickness, altitude sickness or pulmonary edema or cerebral edema, whatever you say. Now the question is that if you must have some idea about altitude sickness. Not only you, but all physicians should know, because you have to advise to your patient. Because the patient will ask you, Doctor, অসুবিধা হবে না তো? So they should understand that what অসুবিধা can happen, and if there is an অসুবিধা, how you will take care of that অসুবিধা. So altitude sickness in acute mountain sickness has got some symptoms, and in case of cerebral edema, always you have the cerebral symptoms. If there is a high altitude pulmonary edema, patient will have significant dyspnea, orthopnea, cough. So all these issues you must have an understanding, and you have to educate the patient to recognize that how to understand the sickness, acute mountain sickness or high altitude cerebral edema or pulmonary edema. Now if we look into the data suggests that the acute mountain sickness occurs above the age of 4500 meter in 50% of the patients. So we are sure that some of us will have the acute mountain sickness. And as you know, the acute mountain sickness is very, very easy to treat. Treatment is quite easy because the only thing you have to do is the rest. Rest, rest, rest. The most important point to remember, don't climb up. If you further climb up, then acute mountain sickness will land up into high altitude cerebral edema. So most important point to remember, just take rest. Within 1 hour, 1 day or 2 days, the altitude sickness will disappear, and once the altitude sickness disappear, then you can reclimb again. So acute altitude mountain sickness is not a big challenge, not a big issue, but it is a possibility to many trekkers. You don't have to be afraid about it, just symptomatic treatment, say for example, if there is a headache, take some paracetamol or analgesic, if there is a vomiting, take domperidone, something like that, that is sufficient, nothing more is required. So, when you go up and up, then quite naturally there should be some acclimatization. So, you have to acclimatize with the environment or with the hypoxia, and that is usually carried out by doing an acclimatization trek. What is acclimatization trek? Acclimatization trek is from a height of x, you have to go x plus and come down again and stay there. So, this is an acclimatization trek. So, this is from Namche Bazar we had an acclimatization trek. As you can see, from 3,400 meter we went to 3,800 meters. So, 400 meter trekking in a single day, 400 meter up, 400 meter down, and take rest in the 3,400 meter. So, that is an acclimatization trek. From Namche Bazar we went to the Debuche. There was a beautiful monastery in the Debuche, and from Debuche we went to Dingboche. Now, once I reached Dingboche, it is more than 4,000 meter, and as I've told you already that I already had an experience of Annapurna base camp, so I thought up to 4,000 meter I will not have any problem, because I didn't have any problem. You remember that the acute mountain sickness is sometimes happens to some people, and those who had an experience of acute mountain sickness, they will again have this acute mountain sickness. So, if you do not have acute mountain sickness up to 4,000 meter, there is every possibility you will not have it up to 4,000 meter. So, therefore, I was quite sure that I will not have it up to 4,000 meter. But what will happen above 4,000 meter? It was unknown to me, because I never went beyond 4,000 meter. So, as at the same time you have to understand that above the 4,000 meter there is no any tree. You see, it is barren land, no trees. So, if there is no tree, the oxygen pressure is quite low. So, less amount of oxygen you have. So, therefore, because I was little bit proactive, so I thought let me start the Diamox. So, I started Diamox 250 milligram twice daily above 4,000 meter. Now, from Dingboche we went for another acclimatization trek. So, this is the acclimatization trek. From here we went up to here. It was roughly around 500 meter trek, 600 meter trek. So, in the same day we went up and came down and rest. So, acclimatization trek is a part of the trekking route, and it is basically followed all the trekkers. This is SOP, standard operating procedure. So, now coming to that, if you want to prevent the acute altitude sickness, what you are supposed to do. As I have said that I have already said that I started the Diamox tablet 250 milligram twice daily. So, the most important issue you have to remember, why the people develop acute mountain sickness. Number one is the height. At what height you are going. So, I have said that 2,000 meter is no issue, anybody can go. So, when you are crossing 4,000 meter, there is a possibility. So, if your patient telling you that the doctor kiju habe na to, the first question you should ask, where are you going? So, I ask this question, where are you going? And immediately I open the net and check what is the height they are going to reach. If the height is more than 3,000 meter, then it is an high altitude trek, and we should be careful. Second is that if somebody is predisposed to develop the acute mountain sickness, the climb should be slow. So, number one, height. Second is, what is the pace or what is the speed with which you are attaining that height. So, it should be slow. And number three is the past experience, which I have already told you. So the person who has a possibility of developing acute mountain sickness, he should take the preventive medication. So, pharmacological medication, as you can see, acetazolamide twice in a day is basically the standard approach, but you can give thrice in a day, and the meta-analysis suggests the 750 milligram or thrice in a day dose is more effective than the 250 milligram twice in a day. But having said that, I must tell you, I have taken the 250 milligram twice daily. So, there is those who are intolerant to acetazolamide can take the dexamethasone, and if you want to prevent from acute mountain sickness to cerebral edema or pulmonary edema, you can advise them to take nifedipine, or you can say tadalafil, and you can say simultaneously they can start both nifedipine, tadalafil and dexamethasone as well. So, from Dingboche we went to Thukla 4,400 meter, from Thukla to Lobuche 4,900 meter, and then we need to understand that somebody can develop acute sickness. Now among the 9 of us, 2 people had got a very low oxygen pressure, and I will show you that in the Everest base camp, 2 people had an oxygen pressure of 70 and one had less than 70. So 70 is a grave situation, so we had to take some action. Now what the acute mountain sickness happens, and as I have said you, the guideline, the studies suggest that when you are ascending slow, the possibility is less, and if you have got a pre-acclimatization, so quite naturally the possibility is much less. So as I have said, slow ascent. Number 2, pre-acclimatization. Number 3, if you are very prone to develop acute mountain sickness, you have to take preventive measures, pharmacological or non-pharmacological. Now the question is, if there is an acute episode, acute mountain sickness, what you will do? And the patient must understand this, because throughout the journey you may not have medical support. So you need to understand that how you should treat yourself. The patient should understand that how they are going to treat. So in mild, I have told you already, in the cerebral edema, dexamethasone, high altitude, if there is a pulmonary edema, the nifedipine and tadalafil are the choice. So this is my tips for high altitude trekking. You have to take good amount of water because there is a dehydration. So if you are feeling thirsty, it means you are not hydrating yourself good enough. Water, water, water. That is the very, very important issue. Second, no alcohol. During the whole trek, you are not supposed to take, even our guide and our porter didn't take any drop of alcohol. When we came back, then we had the party, but not during the trek. Take extra protein, not glucose, rather protein is important. Good acclimatization, climb slowly, and you have to take some medicine to take care of acute mountain sickness. So on the 10th day, we reached the Everest base camp, and then we came back to Feriche. Is a beautiful village, then by chopper. And during the trek, I had an AGP, and the AGP shows that the blood sugar was perfectly normal, but you can see at Lukla, my oxygen pressure was 94, at Everest base camp it came down to 85. So this is the amount of calorie we spent, and this is the total distance we traveled every day. So total roughly around 85 kilometers. So key message is that the high altitude oxygen transport to the body tissue improves during the first days or weeks through the process of acclimatization. The main risk of acute mountain sickness is lack of acclimatization, individual susceptibility, rapid ascent and high altitude. The essential elements of medical counseling for the tips to high altitude are assessment of the risk of altitude sickness and the cardiopulmonary issue. Please remember, 2 things we have to remember. Whether the patient has got a possibility of developing acute mountain sickness or not, and cardiopulmonary issue. And person with diabetes, coronary artery disease, chronic obstructive pulmonary disease or bronchial asthma who have good performance ability for their age and medical stable can plan trekking up to 3000 meter. Beyond 3000 meter is a challenge, and from my side it is no. Thank you very much for your patient listening.
Thank you, Anirban, for the vivid description from an avid trekker, I should say. And who else but you can call it a horse's mouth, whatever we have learned. It's a storytelling, as I was telling you at the beginning. Some of the wonderful pictures you have shared. So I think let me hand over the microphone to my co-chair if you have anything to say.
Thank you, Anirban, as usual. And it was a vivid description of the whole journey. But I have one query. In patients with diabetes who are enthusiastic, I do have 1 or 2, those who trek annually. You talked about the CGM. One of them always carries the CGM, but the glucometer, those are not accurate because glucose oxidase, it doesn't work. So 1 or 2 words about that. And apart from that, the diet. For a normal person, the high protein diet, definitely it will prevent the sarcopenia. But for patients who are on OHs, insulin people may not venture, but who are on OHs, what is your advice for the diet? A brief, the carbs, the type of carbs to be carried. Because high altitude, you have hypo, because you are trekking, you require more glucose, as you said. And also due to the cold temperature, there is low breakdown of fat. So hypoglycemia is a definite problem for diabetics. So 1 or 2 words about the diet.
So as I've said that the diet means that the patient, whatever diet the patient was taking before starting the trek, that they can continue, but you have to give some importance on the protein intake. The excess, actually what happens that the people usually carry the chocolate, and the chocolate means it carries the carbs and the fat. So that's not a very good choice while you are going for the trekking. I personally feel that the taking extra amount of protein will be the good choice, and protein usually don't raise the blood glucose. That is an important issue. So there is no conflict of intake of excess protein and the diabetes unless until you have a renal impairment. So that is a separate issue. So I think nobody who have significant renal disease will be allowed, because renal disease associated cardiopulmonary issue as simultaneously. So I always advise you go for good amount of protein and the calorie. But the problem is that when you are going up and up, there is anorexia. And if you take Diamox, it causes further anorexia, because Diamox actually changes the taste sensation. So naturally the people cannot eat much, but at the same time you have to walk. At the same time you are losing calories. So that's an important challenge, difficult challenge. But I think that you have to monitor the blood glucose, and if the blood glucose tends to fall, you have to correct it with the glucose. There is no other way, but you have to give glucose.
Basically, pre-trekking, the dosage of medications, you have to counsel and advise to the patient, because
Dose.
Dose of any patient on OHs.
Yes.
Obviously, we have to
Yes,
talk
but
about them. They have to be counseled.
You
That is
can,
what
I don't think
Like
I will
Ramadan
I
preparation.
will ask to reduce the dose, but I will ask rather frequent monitoring is important. And if you have AGP, that's very good, because you don't have to prick, because quite cold. In the Everest base camp we face minus 22 degrees centigrade. So that's a quite cold environment. So rather an AGP is a better choice. And at the same time, please remember the glucometer is not perfect in the high altitude. That's an important issue.
Discussion is open to the floor now. We can have one or two questions at the most because of paucity of time.
থ্যাংক ইউ অনির্বাণ দা, মনে হচ্ছিল যেন ট্রেক করে ফিরলাম এই মাত্রই, প্রায় পৌঁছে গেছিলাম। ঠিক আছে, তো কোনো কষ্ট হয়নি, কিছু ডিফিকাল্টি হয়নি। ইজ দেয়ার এনি কাট অফ লেভেল অফ ব্লাড প্রেশার ফর হাই অল্টিটিউড ট্রেক? বিকজ মোস্ট অফ দ্য অর্গানাইজেশন যারা ট্রেক অর্গানাইজ করে তাদের অলওয়েজ একটা বিপি কাট অফ লেভেল দেয়, যে এই বিপির ওপরে গেলে একটা লোক ওইখানে যাবে না, এটা একটা ইয়ে থাকে, লিমিটেশন থাকে। সো ইজ দেয়ার এনি, অ্যাজ ইউ হ্যাভ, আপনি যেমনভাবে কাট অফ দিয়েছেন যে এটা হলে এই অল্টিটিউড ওই অনুযায়ী কোনো কাট অফ লেভেল আছে?
No, but if you have hypertension, you must have well-controlled hypertension. But if you have an uncontrolled hypertension, then it is very difficult. Because when there is when you are going up, there will be increase in the blood pressure because of sympathetic overactivity, which I have already said. So therefore, unless and until you have well-controlled blood pressure, less than 140 by 90, you should not allow somebody to go for high altitude trek at least. 2000 meter is okay.
3000 এর উপরে গেলে 140 90 এর উপরে আর যাওয়া উচিত না।
উচিত না।
ঠিক আছে।
There is no any good guideline for the acute mountain for the high altitude trekking, but this is my perception.
আমাকে একজন ফোন করেছিলেন যে ডাক্তারবাবু আমাকে বোধহয় আটকে দেবে, তো আমি ওই সময় কোনো মেডিকেশন দিয়ে বিপিটা একটু জালি কাজ করে
আটকে দেওয়ার কিন্তু কেউ নেই।
আমি একজনকে পাঠিয়েছিলাম, কিন্তু উচিত না।
আটকে দেওয়ার কেউ নেই। There is no any medical checkup when you are going for trek.
না, আছে আছে আছে। ওরা বিপি কাট অফের উপরে গেলে
যেটা ট্রাভেল এজেন্ট যায় না,
হ্যাঁ,
the travel agent, because they do not want to face any issue, they check, but there is no check on behalf of the government.
আচ্ছা,
no check on behalf of the government. It is they check because they do not want to face any adverse situation during the process of, because it is their burden.
Okay.
So the issue is, it is whether there is check or no check, that's not the issue. It is for your interest. You should get yourself checked and get the blood pressure under control.
Thank you.
One-liner, please, Dr. Bansal.
For high altitude training, say more than 4,000 or 5,000 meter, more than 4,000, what minimum basic investigation we should advise the patient, like ECG, stress ECG, echocardiography, routine blood test? What basic minimum investigation should be advised?
The three or four things you should know. Number one is your cardiac status. Number 2, your pulmonary status. And number 3, if you have metabolic disease, glycemic status and blood pressure. So these are the 3-4 things that we need to understand, that whether you are fit for this or not. I think majority of us undergo at least yearly once checkup. So that is good enough, I think. And if you do not have any pre-existing illness, there is no detailed thorough evaluation is required unless and until you have some kind of symptoms. So if you do not have any symptom, any cardiac symptoms or breathlessness, something, no detailed investigation is necessary. One simple ECG is good enough. But if you have pulmonary disease, then quite naturally you have to go for PFT or something like that. But I will advise that those who have cardiopulmonary disease not to go for trekking, that they may develop some problem. And you know, in the trek you may not get good support, healthcare support.
Thank you, Anirban, for everything.
Thank you.
And I'll conclude the session. And I thank all of you for your, avid listening and encouragement. Thank you.
Thank you.
Thank you so much, Speaker. Thank you, Chairperson. It's time to felicitate our Speaker. I would like to request the both Chairperson to please felicitate him. Thank you so much, sir.